Hi guys, Dr. Presses here coming to you from the North Dallas Spine Center. And today I want to discuss how we go about handling difficult spinal conditions in our office. So every spinal condition has two main components to it. So we're going to have something known as compressive tissue damage, that's component number one. And then there's component number two, known as the underlying theme or an underlying cause in terms of how that got like that in the first place. So as far as compressive tissue damage, this is what I'm referring to right here. So we can see how here there's a lot of compression showing up between these two vertebrae where the space is smaller. So that's degeneration, that's wear and tear. When that gets going like that, that creates an effect known as a disc herniation or a bulging disc, where when the disc runs out of room, it has to go somewhere, so it ends up going to the back, which is the weakest part of the spine, and that ends up irritating this nerve root right here. So just to give you an idea, this is a bad one here, and then this is a healthy one. So you can see in comparison how that space, how that size of that disc should look in terms of being healthy and normal. So once we get into a situation like this here, that'll put pressure on this nerve root here and create sometimes pain down the leg, pain down the arm, neck pain, low back pain, chronic pain, all sorts of issues that can be associated with this here. So the way we go about treating this here is through a non-invasive approach known as non-surgical spinal decompression. Now the way this works is it'll take something like this here and gently distract these vertebrae without causing pain. Now as it does that here, it's gonna open up those gaps and take pressure off that disc. As we take pressure off the disc, it gives the disc a lot of breathing room, which in turn alters the pressure on the inside of the disc to go from positive to negative. And that positive to negative effect ends up creating a huge vacuum effect of any part that's sticking out and irritating that nerve. So it's going to draw it back in as much as possible to where the rest of it is. All right. It's also going to allow water to go back in there to help it rehydrate and get that to become tall again as much as possible. All right. That's how we target the compressive tissue damage. Now here also we take things a step further and we isolate and locate the reason why this got like this in the first place. And oftentimes that underlying cause is structural related, alignment related, postural distortions that we all develop over time based on certain factors. So when this gets thrown off like that and there's more weight on one side, for example, that'll create repetitive wear and tear over time and lead to more and more dysfunction and more repetitive damage. So the way we target that here is by utilizing something called the NUCA procedure. Now, as far as the NUCA procedure, that is centered around the top of the spine, right at this bone here. So this bone is super important because that supports the weight of the head. This is what the head sits on. That's why they also call it the atlas, all right? Now, this bone is already unstable to begin with because it has to rotate and be able to turn your head. Now, because of that, a lot of folks will develop a lot of misalignment in here and not even realize it. It tends to go undetected until symptoms start, all right? And many times folks don't necessarily hurt up here, but the way it factors into everything else, especially the low back, is if this part gets shifted or tilted, that offsets the weight of the head and the head gets tilted. And because the head weighs quite a bit, it's like a bowling ball, 10 to 14 pounds, that creates a lot of distortion throughout the rest of the spine because things will start to compensate for this being out of alignment and out of position. So the way we target this here is I look at the entire spine, but I also examine up here and determine how much misalignment is sitting at the very top of the spine through exact measurements that are unique to that person, like a fingerprint. And I use those measurements to make really precise corrections at the very top, utilizing my hands, but without any twisting or popping. And as we change up here, that's gonna rebalance out the head, which in turn creates a drastic chain reaction down the entire posture, down the entire spine, where it ends up stabilizing the condition and resetting the underlying picture, the underlying cause, all right? And that's called the NUCA procedure. So here in our office, we utilize the NUCA procedure in conjunction with the spinal decompression, and we're one of the few offices in the United States to use both at the same time to get our results. And that allows us to get more of a complete resolution of the symptoms and a complete recovery of the condition itself. All right. So if you guys are struggling with herniated disc, bulging disc, pain down the leg, pain down the arm, and want a second opinion, contact our office today and we'd be more than happy to help. All right. Hope this helps, guys. Thank you very much. and I look forward to talking to you soon. Take care. Bye-bye.